Hello guys, so now we shall be discussing regarding the branches of the abdomen. Okay, so all of you know the abdominal aorta has got many different branches. So now we shall be mainly focusing on the three main branches. So what are those three main branches? One is called as your celiac trunk, another one is called as your superior mesenteric artery, and the third one is called as your inferior mesenteric artery. Okay, so these are the three branches which we shall be concentrating right now. So we shall be discussing about celiac trunk, superior mesenteric and inferior mesenteric. But before that, let me draw one small picture. All of you know that this is the heart, right? And from your left ventricle, you have got a branch that is coming out. This is called as what? This is called as your arch of aorta. So this arch of aorta, and after that you have got the thoracic aorta down here, right? And here comes your diaphragm. Now just below the diaphragm, whatever aorta you have here, this is called as a descending part of the aorta or the abdominal aorta. So this aorta over here, you can call it as the thoracic aorta. This is the abdominal aorta. So abdominal aorta and thoracic aorta together, you call it as a descending aorta. Descending aorta. Now when it comes to the abdominal aorta, within the abdomen you have got many branches, okay, but main three branches are, one is called as the celiac trunk, superior mesenteric, as well as the inferior mesenteric. So where does the celiac trunk generally originate from? We shall discuss. First of all, celiac trunk starts at the level of T12. Let us say this branch which I am drawing right now is a celiac trunk. It is starting at the level of T12. When you come little bit down at the level of L1, there is another branch that is coming like this. This is called as a superior mesenteric artery. When you come little bit down at the level of L3, you have got another branch that is coming, that is called as the inferior mesenteric artery. Okay, so this is the celiac trunk. This is the celiac trunk. This is the superior mesenteric artery, and this is the inferior mesenteric artery. Where is the celiac trunk present? The celiac trunk is present at the level of T12, superior mesenteric artery at the level of L1, inferior mesenteric artery at the level of L3. At the level of L3. Okay, so these are the three important branches. So now we shall be discussing the sub branches of these main trunks over here. Okay, so first of all, our discussion here, you have to know that to which parts does this does the celiac trunk supply. You have to know that celiac trunk is exactly located in the center. So it supplies onto the right side. On the right side, what do we have? We have got the liver. So it supplies to the liver on the right, and on the left side we have got the spleen. It supplies to the spleen on the left, and in the center here we have got the stomach. It even supplies to the stomach. So it is giving three main branches. One branch to the liver, one branch to the spleen, one branch to the stomach. Okay. So what we shall do? We shall draw those three main organs. So this is your stomach. This is the stomach, and we shall also draw the liver. This is your liver, and here we have got the spleen. So these are the three main branches which you have to know here. Okay, three main branches. Now here all of you know that the center part which I am drawing right now, right? So this center branch which I am drawing right now is your abdominal aorta. Okay, this abdominal aorta has got a branch over here, as I already told you. So this branch here is called as a celiac trunk, which is located at what? It is located at the level of T12. It is located at the level of T12. Now this this celiac trunk gives, as I already told you, this gives a branch that goes like this. It goes behind the stomach in a tortuous fashion like this, and then it straightly supplies to your spleen. So this branch is called as a splenic artery. Okay, so what we shall do is that we shall just write down the names. A stands for splenic artery. Next, from the splenic artery, we have got a branch that is going on to the top. We have got a branch that is going on to the bottom. The branch that is going on to the top, that is called as the short gastric artery. Next, this C here is called as the left gastro-omental artery. Okay, so what is this? This is called as the short gastric artery. This is called as the left gastro-omental artery. Left gastro-omental artery. Next, from the celiac trunk itself, we have got another branch that goes all the way like this, and it is supplying to your lesser curvature of the stomach, right? So this branch is called as a left gastric artery. So let us write it as D. D stands for left gastric artery. This is what? This is called as your left gastric artery. So it has given one branch to the stomach, it has given one branch to the spleen, now it is giving the branches to the liver. Now when it comes to the liver, it gives a branch like this. This is called as a E. What does E stand for? E stands for, this is called as hepatic artery proper. What is this called? This is called as hepatic artery proper, and this hepatic artery proper divides into two branches. What are these two branches? One branch is going up and one branch is coming all the way down like this. The branch which is going up, later on this branch will divide into two branches. One is called as your left hepatic artery, another one is called as your right hepatic artery. So this branch which is going up is called as a common hepatic artery. So this is called as a common hepatic artery. So hepatic artery proper has given out two branches. One branch that is going up, that one you call it as a common hepatic artery. Another branch that is going down. What is the name of this branch, guys? What name will you put to this branch over here? Yeah, this branch is present between the stomach and the duodenum. Yes or no? This branch is present, is lying in between the duodenum as well as the stomach. So you call this branch as gastroduodenal artery. What is the branch you call it as? You call it as a gastroduodenal artery. Right. Now after this, from this gastroduodenal artery itself, you have got a branch that goes all the way and it supplies your, or it anastomoses with your left gastromental artery. So if it is anastomosing with left gastromental artery, then this branch should be called as right gastromental artery, right? The other name for left gastromental artery is left gastroepiploic artery. So the same goes for the right also, right gastroepiploic artery. Right, now here two branches are there here. So gastroduodenal artery divided into two branches. So one branch you call it as the right gastromental artery, and this is another branch that is coming down. Okay, so from here all the way till here, this is your gastroduodenal artery dividing into two branches. Now what is this branch here? This branch here is called as superior pancreatoduodenal artery. This one is called as a superior pancreatoduodenal artery. Okay. Now here I already told you that this branch over here is called as the abdominal aorta. So this abdominal aorta comes all the way down like this. So this was your abdominal aorta which is coming all the way down here, right? Now this abdominal aorta, I told you at the level of L1, it gives out a branch. What is the name of the branch which it is giving out at the level of L1? That is called as a superior mesenteric artery. So let us say this is your superior mesenteric artery. From superior mesenteric artery, you have got a branch that is coming. Okay, and this branch is anastomosing with what? Superior pancreatoduodenal artery. Right, so this is called at the level of L1 and this is your superior mesenteric artery, and this branch over here you call it as the inferior pancreatoduodenal artery. One you call as the superior pancreatoduodenal artery and this is called as the inferior pancreatoduodenal artery. Right, so it is coming from what? Superior mesenteric artery at the level of L1. Right. Here one more important branch you have to observe. What is that? From this hepatic artery proper, you have got a branch that is anastomosing with the left gastric artery. So this will become what? This will become your right gastric artery. This is called as your right gastric artery. Okay. So let us just name out all these branches, guys. So instead of naming it out, let me write down the list here so that you will understand it better. Okay. So let me write down the list over here so that you will understand better. So first of all, let us finish off with the main branches. So coming to these main branches, so we have to discuss that what are the different main branches we have got. We have got three main branches as far as I have drawn in the picture there. Okay. So what are these three main branches which we have got? One we have got is the common hepatic artery. One we have got is the hepatic artery proper. Hepatic artery proper. One we have got is the splenic artery. Splenic artery, and the other one we have got is the left gastric artery. Left gastric artery. Okay, we have got three important branches. So one is called as your hepatic artery proper. We have got the left gastric artery. One we have got is the splenic artery. These are the three important branches which we have got here. Now in this hepatic artery proper, as I have already told you, hepatic artery proper will mainly divide into two main branches. So what are those two main branches? See, hepatic artery proper dividing into two main branches. One is called common hepatic artery and gastroduodenal artery, right? So one is called as the common hepatic artery. Another one is called as your gastroduodenal artery. Okay, this hepatic artery proper will further divide into two branches I told you. What are those two branches? One is called as the right hepatic artery, another one is called as the left hepatic artery. Okay, and in the same way gastroduodenal artery also divides into two branches I told you. What are those two branches which it divides into? One is called as your right gastro-omental artery, another one is called as your superior pancreato-duodenal artery. Superior pancreato-duodenal artery. Superior pancreato-duodenal artery and the right gastro-omental artery. So these are the two branches of gastroduodenal artery. Right, now after that we have got something called as a splenic artery. Okay, splenic artery is giving out two branches. One is called as a short gastric artery, another one is called as a left gastro-omental artery. Splenic artery is giving out the two branches. What are those two branches? One is called as the short gastric artery, another one is called as the left gastro-omental artery. What is the another one? That is called as a left gastro-omental artery, and the other one is called as your short gastric artery. So these are the overall branches which you need to know, right? And superior pancreato-duodenal artery, don't be confused here, that superior pancreato-duodenal artery anastomoses with what? It anastomoses with inferior pancreato-duodenal artery. Next, right gastro-omental artery anastomoses with what? It anastomoses with the left gastro-omental artery. So these are the overall branches of the celiac trunk which you need to know. Another one very important clinical point I would like to mention here is that, so here this ligament which you can see here is called as a median arcuate ligament. What is this? This is called as a median arcuate ligament. Okay, so this is the normal presentation of your celiac trunk. Right, now what will happen is that whenever this median arcuate ligament, sometimes it can compress the celiac trunk. So when it can compress the celiac trunk, this would lead to a condition. See, this is your celiac trunk. Okay, see, it is compressing the celiac trunk. So this would lead to a condition called as celiac trunk compression syndrome. So in that case, what will happen? The blood supply to your liver, spleen as well as the stomach, it is hampered. Okay, so this is all you need to know regarding the celiac trunk and its branches. So thank you so much for watching my video. Goodbye.